everyone, and welcome to Inside Healthcare. You just never know when your life can suddenly change. One St. Paul man knows that all too well. 4 years ago, he was nearly crushed to death when a tree fell on top of him. He's made a remarkable recovery, but he still deals with daily pain. He's found a rather unique way to help reduce that pain, though. Take a look.
This year I did a completion of the North Shore Inline Marathon from Two Harbors to Duluth. It's very similar, virtually the same route as Grandma's Marathon. It's a 26.2 mile course, and I finished in 2 hours, 33 minutes and 41 seconds, kind of in the middle of the pack. You think a lot about breathing and a lot about looking forward. I get an endorphin blast out of things, which is the best pain control that I ever experience. And there's, with the high aerobic activity, you get a real nice oxygen cleansing. I don't think that there's an hour of my life that I don't reflect back to 4 years ago. I'm basically piled onto the ground, and I could not move and I couldn't get up. It's the most helpless physically that I've ever been in my life. They create an environment where you are gently challenged. They have ushered in a period of time where I've experienced the most miraculous kinds of pieces of my life that I've ever experienced. They kind of gave me a rebirth at minimum, and I look to them as being the inception of having a new life.
Natasha Fleshman did not have a tree fall on her, but her life changed as suddenly and as drastically as Dawn's did. We're very pleased to have with us Natasha. Thank you so much for being with us today.
Oh, I'm glad to be here. Thank you, Jody.
So maybe you can kind of take us back to what happened to you, how did it happen, when did this happen?
It was 10 years ago. I was 33 years old, and it was actually on January 24th. I just celebrated my 10-year anniversary a couple of weeks ago.
Well, congratulations.
Thank you. That was a big deal for me and for my family. At that point, I had 2 little boys. They were 3 and 6 years old, and I was working for the St. Paul Public School District. One day, I went in around noon. I said goodbye to my husband, who was just getting home. I dropped the kids off at the babysitter and went into a meeting with a couple of coworkers. While at that meeting, my heart stopped. I slumped over. They didn't know what had happened. They did everything right. One of them ran and had 911 called and ran to get help, while the other one stayed with me and prayed over my body.
At 33 years old?
At 33 years old with no known heart condition. I didn't know I was in danger of ever being seriously ill. But they ran up to 4th floor. We were on the 1st floor and got someone who knew CPR, brought him back down with me, and he performed CPR until the St. Paul Fire Department showed up. At that point, they defibrillated my heart 5 times before they got it going again. With the big shocks like you see on emergency shows on TV.
Wow.
And took me to the hospital. In the meantime, they had called my husband, and he beat me to the hospital. And he said, you know, I'm looking for my wife. Do you know where she is? And they said, oh, we're closed to all but level 1 traumas. She must have gone somewhere else. And at that point, the person at the desk began calling around and trying to figure out where I was. And while that was happening, I was wheeled in past him. And he had seen me half hour, 45 minutes earlier, normal, vibrant, healthy, and now I was being wheeled past him looking like I was dead.
Wow, so what happened next then?
They took me in. I had been eating lunch at the time, and I aspirated my carrots, so they had to vacuum those from my lungs. They took me into the cath lab and did a full cardiac workup on me, just trying to figure out why this healthy woman suddenly died. The good news was my arteries were clear. But I was found to have dilated cardiomyopathy, which is an enlarging and weakening of the heart muscle. And at that point, with each beat of my heart, only 10% of the blood was being sent out to the rest of my body. And so I was in severe heart failure without knowing it.
Wow. How could you not, you couldn't feel any, were you tired or did you have any symptoms looking back at it now?
Looking back at it, I recognized there were symptoms going along, but my 3-year-old was a very difficult child.
Yeah,
and
so
so
you just, yeah.
I just thought I was a tired mom. But this happened in the winter, and I remembered the summer beforehand. We lived near Como Lake, and so we'd go out walking, and that summer I was getting mad at my husband because he was walking so quickly that I was always a few paces behind. Well, he wasn't walking any faster, I was just slowing down. So it was probably in heart failure at that point. And when I looked back, the funny thing is we put our house on the market that very same day. And so
the very same day that your heart stopped?
Yes, it was that week. And the weekend before that happened, I had gone up north with my mom and the kids so my husband could stay home and clean the house. And when I was up north, I looked down at my feet and they were puffy. You know, like when you're pregnant and you're retaining water, I had puffy feet and I thought to myself, I even have fat woman's feet.
Oh.
But now I recognize that as another sign I was retaining water due to heart failure.
Do you remember any of, when did you finally come to in the hospital and did you wonder what, or were you in a coma or anything?
They kept me in
an induced coma?
In an induced coma for a few days. And then I was awake and I was talking to people. I'm an avid Scrabble player, and my sister played Scrabble with me to humor me, but it sounds like I was probably making up words, but she didn't want to challenge me on them. A couple times I picked up the phone and called my coworkers and said, oh, I'll be at work tomorrow. Another funny story is we were sitting in my room, my husband and I, at the hospital, and I was looking out at the nurses' station saying, honey, there's a party out there. Why are we just sitting here alone? And so, like a dutiful husband, he escorted me out, and we walked around with my monitors and IV and walked down the hall till the alarm started going off because I was leaving the telemetry unit. And he said, we have to go back now. And I got back into bed, and I said, well, they sure weren't very friendly. But I was really disoriented, and it was pretty scary for my family. They thought that was the person who was going to stay.
Wow.
But I was released. My first memory was my electrophysiologist, the cardiologist who implanted, I have an implanted defibrillator.
So did they put that in at this hospital stay then?
Right, in that same one.
So like if your heart were stopping again, it would jump you?
Yes, we call it like having a paramedic in your chest.
Oh, I can't imagine what that must feel like.
It's interesting. But that was my first memory of seeing him. And then I woke up in my hospital room and I saw my mother and I asked her what happened. And she had told me that multiple times already during the week, but this was the time I would remember.
So what did she say?
She said, your heart stopped, you've been in the hospital for a week. And, you know, it was a whole new world for me, completely different from when I went out. I was now a woman with a life-threatening condition. And at that point, you know, this was 10 years ago, so the research was much further behind where it was now. They had just introduced some new drugs to market that they didn't have hard data on yet. And so when I got home and started to research this disease that I had, they were saying a majority of the people would die within 5 years. And so my prognosis that I developed in my own mind, my doctors never said anything like that, but you know, as a proactive patient, I wanted to really do the research and find out what was going on. And so when I had my 5-year survival hit that anniversary, we had a great big party.
Wow, good for you.
Yeah.
Yeah, I bet that was quite a celebration.
It was a lot of fun. My kids still talk about the chocolate fountain.
Yeah, they remember things like that.
Yeah.
Dark chocolate, right?
Yes, of course.
Of course, yeah.
And nice fruit to go in it.
So did your defibrillator or internal implantable defibrillator, did that ever go off at all?
For about 7 years it did not.
Really?
Yeah, and I had it replaced once because of a recall, and then I had it replaced again because the battery wore down. Even though it doesn't shock me, it paces me, you know, 80% of the time.
Really?
That's part of
Okay.
my therapy to keep my heart beating regularly, is to have the pacing there. But 8 years after my original cardiac arrest, I had my first cardiac arrest after that, and was driving in the car with my family, thankfully in the passenger seat. And what we find amusing, it was on the way home from church. But exiting the highway, and something wasn't feeling right, and I passed out and woke up kind of going boom when I got the shock in my chest.
Wow.
And my husband was pulling over the car, the boys were in the back seat, and everybody was panicking, you know, what's going on.
I imagine, yeah, especially for your boys too.
Yeah, they've seen it a few too many times. And so that was my very first shock, and then almost exactly a year later, I had my second shock. And that was just a little over a year ago now that I had the second one. That time I didn't pass completely out, but kind of fell out of into semi-consciousness and was awake for the shock. People always want to know what it feels like, and to me, it felt like there was somebody in my chest punching to get out. It wasn't terribly painful, but it was jolting.
Oh wow, I can't imagine. Especially when you're just sitting there and all of a sudden you feel this.
Apparently my son in the back seat said, "Mom, right before it happened, you said, 'Oh no.'" I kind of got that feeling, you know, that something wasn't quite right, and said, "Oh no," and then got the shock. And this time it was on Christmas Eve on the way to church. And that's why we're finding it really amusing. Maybe going to church isn't good for our family.
Well, that you come on the other side, I would say maybe it is.
Yeah,
But,
that's what's keeping me alive.
So then I understand, though, that you did end up in the hospital last year around this time. What happened?
Last January, I had been feeling run down for a couple of months. And I'm now 43, because 10 years after the original cardiac arrest, and I was kind of sitting in front of the fireplace shivering and then sweating, and in my head I thought, oh, maybe I'm starting menopause. Maybe this is what a hot flash is all about. Mm-hmm. But I was going to bed early, just not feeling quite right. And I finally went into the doctor in mid-January, and she knew something was off, so she performed blood cultures on me. Mm-hmm. And they found that my blood was rampant with bacteria. I had a strep bacteria coursing through my body. And so I was admitted to the hospital, and still hadn't connected it in my head that it might be related to the heart. But they sent me in for an echocardiogram, and in there they found that the bacteria vegetations were growing on my mitral valve. And it was kind of a fun picture to look at, because you could see the valve in the echocardiogram, and then the bacteria, it was like, you know, seaweed is what it looked like, little seaweed. And so they had to pump me up on lots of very hardcore antibiotics. And after a few days, the vegetations had grown rather than shrunk. And so they put me on a whole new regimen. And once that was under control, they the mitral valve was shot. They needed to replace that. And so I had open heart surgery just a little over a year ago, where they took out the old mitral valve and replaced it with a new mechanical valve. I had the choice between an animal valve or a mechanical valve. An animal valve would not require me to take blood thinners, and a mechanical valve does require taking blood thinners, but a mechanical valve lasts longer than an animal valve. And so I decided, rather than risking having to have it done again when the animal valve gave out, that I would go for the mechanical and be on blood thinners. But at the same time, I have all this hardware in my chest, the defibrillator and the wires that lead into my heart. And all of that had to be removed as well to prevent recontamination. And that ended up a little ordeal all of its own, because when they put it back in, to make sure that it didn't get recontaminated, they put it in on the right side instead of the left, but they found it wasn't shocking me back as it should have on the right side. And so after a few more procedures, everything ended up back on the left, and I'm now on ICD number 4 in 10 years.
Wow. All of that. I mean, you look wonderful. How are you today?
I'm pretty good, you know. I've been out of work for the last year, but now I'm just starting a part-time job tomorrow, so we'll see how that goes and go from there. It's amazing how long the recovery from the open heart surgery takes, just to get back to your former level of energy and all of that.
So you had to go through cardiac rehab? And
I went through cardiac rehab at Woodwinds Hospital, and I was also sent home on 6 weeks of IV antibiotics. So I had to stay connected to the IVs and have a home health nurse, and kind of a weird situation when you're in your 40s and previously very healthy to have the home health nurse coming. You always think that's for somebody much older than I am.
Mm-hmm. And you were telling me before we went on the air that you actually got out of the hospital a year ago today.
Yeah, it was a year ago today. I was released from the hospital after being in there for 3 weeks, so it was
wow.
a long stay.
Time.
Yeah, I kept thinking I'd get out tomorrow and just never did.
So since you've gone through all this, you've become quite a spokesperson for heart disease in women. Yeah. What are some of the messages that you want women to know about heart disease?
Well, I do a lot of volunteer work for an organization called Women Heart, the National Coalition of Women with Heart Disease. And their #1 goal is to support the 8 million American women who are living with heart disease.
8 million.
8 million women live every day with heart disease. And when you're diagnosed with heart disease, it isn't something, you know, you take a few pills and you're cured. It's something you're going to live with forever, and it's probably what I will die from. Not this year, but eventually. That is what I will die from. And so Women Heart trains about 50 or 60 women heart patients every year at a symposium at the Mayo Clinic, and gives them public speaking skills, teaches them more about the various conditions of the heart. You know, there can be diseases with the artery or with the heart muscle or congenital problems. And then they send us off to educate other women to do things like this interview, or to do presentations. And Women Heart has 4 goals. One is to help women prevent heart disease. The second is early detection, accurate diagnosis, and proper treatment are the 4 goals. Because so often, and that doesn't happen so often in Minnesota, we actually have about a 30% lower death rate for women with heart disease than we do with the average in the country. So I feel very fortunate to live here with the outstanding medical care we have everywhere. But there are many places in the country, and I know many women who were misdiagnosed or who were kind of sent home without any treatment before they finally got to the point where somebody realized what was going on.
And I think, too, historically for a long time that women were dismissed. You know, their symptoms, oh, it's just all in their head, or something like that, that it wasn't really heart disease, and that was a man's disease. And
exactly. Doctors were trained that, you know, previously, that heart disease is a man's disease. You don't need to worry about it. And so women who came in with, you know, tightness in their chest or pain in their arm or their jaw, that they were having an anxiety problem and maybe sent home with anxiety medications. And now, thanks to Women Heart and the American Heart Association's Go Red campaign and the Heart Truth, they're really getting the word out about heart disease being the #1 killer of women. More women die of heart disease than of all cancers combined. And still, women are getting better at recognizing it as their prime risk, but many women still think breast cancer is what they need to fear.
Whereas, is it 500,000 women a year die of heart disease?
Yes.
It's what, 10 times more than the breast cancer is what I understand.
Right, it's significantly more, and we just need more people to talk about it. And I think one of the reasons that women are more reluctant to talk about heart disease is frequently people consider it as your fault that you have heart disease.
Seriously?
You didn't exercise, you didn't eat right, and so it's almost made a disease to be ashamed of. But there are so many risk factors that go beyond, what we eat or the exercise we do on a daily basis.
And what would some of those risk factors be?
Well, the ones you can't control are things like family history of heart disease. There are a lot of genetic conditions. I know women who have high cholesterol no matter what they do, with drugs, with exercise,
and that's
with
total
proper
cholesterol
eating.
Or
total
LDI?
cholesterol, but we're more concerned about the LDL cholesterol. And so the biggest thing that you can't change is your family history. But also African American women and Hispanic women die of heart disease at higher rates than white women do. And
do we know why?
No, it's
not necessarily more prevalent, but they're just not getting the treatment or the prevention that other women may be getting?
That could be it, but I think that's something that still needs additional research to decide.
What would be some of those other risk factors?
So your race, your age, as you get older, your risk for heart disease increases, and family history. But then there are the risk factors that you can change. The #1 thing you could do today if you want to prevent heart disease is if you're a smoker, quit smoking. Then if you quit smoking today, by tomorrow, your risk factors will be lower, your likelihood of heart disease. And within 10 years of no smoking, you will have the same risk factor as a woman who has never smoked. And then obviously exercise, and even if you're overweight, but if you keep your heart healthy by exercising, that reduces that risk factor. And then losing weight is good for everyone. The other thing that really increases your risk for heart disease is if you have diabetes. Women with diabetes are 2.5 times more likely to die of heart disease than any other woman. And so that's something you really want to watch, and that's also done through diet, exercise, and weight loss. And so those are the risk factors you can control and do your best to avoid. And then eat a heart-healthy diet with lots of fruits and vegetables.
And whole grains?
And whole grains, yeah. My husband and I own the Great Harvest Bread Company in Woodbury, and we actually did last Friday was the Wear Red for Women Day to draw attention to women and heart disease. And all of the Great Harvest bakeries in the Twin Cities area donated 5% of total sales to Women Heart to help spread the word and get the word out for others.
Oh, it's delicious bread too, by the way.
Well, thank you.
Yeah, all the products. Some final advice that you might have for our viewers, especially the women out there watching, what would you say to them?
Well, know your numbers, and if you should be on, it's called the ABCs of heart disease. So talk to your doctor about being on an aspirin regimen. A heart attack is caused by a clot that can sometimes be avoided by taking aspirin. Forgetting my B's and C's.
I can't help you there.
All right. But know your numbers. Or
go look at the American Heart Association. I bet they have the...
Yeah, and Women Heart has it also on their website. I'm sorry, I just spaced out there. But make sure you see your doctor and know if your cholesterol's high. If you have a history of heart disease, talk to your doctor about it, because your doctor is going to want to take more time with you. Exercise, 30 minutes every day should be your goal. eat healthily, and one thing women often do that causes more problems for them is they put everybody else's needs ahead of their own.
Absolutely.
And so you need to pay attention to your own body, and if something doesn't feel quite right, get it checked out. And if they dismiss you, say, no, I need to be seen. Things like a pain in your left arm. I know another woman who had a pain in her jaw, and she actually went in and had a root canal, when in reality she was having a heart attack.
Really?
And so women really need to advocate for themselves and make sure they're seen and treated, because time is heart muscle when it comes to something like a heart attack.
And final comments from your perspective. I mean, how has this changed your life in these last 10 years?
I actually consider it the biggest blessing. I am a completely different person today because of what I've experienced. I don't mind wearing a V-neck and showing off my heart scar, because if you don't know about my scar, you're missing a core part of who I am. You know, I've been through a lot, but it's made me stronger, not weaker. And I do everything I can to make sure other women are aware of their risks, and do whatever I can to help spread the word that women have to be careful with heart disease.
Well, Natasha, it's been a pleasure to have you with us today and sharing your story, so thank you so much. Appreciate that.
Thank you, Jody. I enjoyed it too.
Thank you. And if you would like to get some information as part of the Go Red campaign, the HealthEast Women's Heart Advantage is providing free health screenings throughout the month of February, including one at the health fair at St. John's Hospital in Maplewood on Thursday, February 16th from 10 to 4 p.m. The free screenings are available to both men and women, and they'll check your total cholesterol, your HDL, your blood sugars, your blood pressures, body mass index, BMI, and some of the screenings will also include a HealthEast Ask the Doctor to discuss your concerns for risk for heart disease. For a complete list of the dates and locations for the free health screenings, visit healtheast.org/heart. And on that note, we'd like to thank you for being with us and hope you all enjoy a nice, healthy heart this month of February. Thanks for joining us. We hope you'll join us next time. We'll see you next month on Inside Healthcare. See you then, everyone.
Inside Healthcare. For more information, visit stjohnshospital-mn.org or call 651-326-7800.